Now, I want to ask you about the very first video you did. Do you remember that?
Oh gosh. Honestly, I don't. There's been so many. I remember some of the first videos that I did, but I've kind of intentionally left them behind. I don't want to
Right.
think about them too much, but I'll go there if you want me to.
So you did a
Uh-huh.
neck pain a video, and it was short. I think it was under 2 minutes, but how to prevent neck pain, how to correct your posture, how to tuck in your chin. So
Okay.
I just wanted to see if you remembered that, and what made you put out that first video.
Was that the
Um,
one where there's a woman on there?
yes. Uh-huh.
That was my wife. Yeah, I remember that video now.
Yes. So that was your first one in 2014.
Wow.
So, and I just wanted to ask what was going through your mind when you say, hey, you know what? Let me do this first video. Let me just take the plunge and let's go for it.
hmm Well, I had already been doing custom videos for patients because a lot of patients would ask me, "Hey, can you write down all these exercises that you're giving me, or can you write down some of this information that you give me?" And I would at the beginning, I would type it out on a document, and it would take me forever. And then I just realized it takes me like 2 minutes to shoot a video real quick and just say everything
Right.
that I was going to say on paper. So let me do that. So I think that I did that video as one that I was going to give to a client, but then I realized I should just slap this up on YouTube because I need to start putting it in on video in places. And let me make it generic. I'm not going to say, hey Phil, or hey Lupe, here's a video for you. I'm just going to say, hey everyone, let me tell you about neck posture, and I put it up there, and then I just shared the YouTube link, the
Yeah.
URL over with the patient. And I realized I could just start doing that with all kinds of videos about health tips and exercises and advice that I would normally give for an individual patient.
Right.
Um, and then I had a library there, so it's accessible for my staff to hand out to patients whenever they need it to.
Right. And I think that's a big key is just to share your knowledge, educate, and inform your clients and your patients. So
Mhm.
from going from 2014 to going over hundreds of videos on your channel
Mhm.
to over 1 million views, what advice would you give to another doctor, another physical therapist, a healthcare professional if they're thinking about making educational videos or jumping onto YouTube as well? What tips would you share with them?
There's a lot. Um,
Give us
I
your
guess
top three.
top three tips. Okay. First tip is just go, just start. Be okay with feeling like it sucked, because
Right.
you have to get used to the sound of your voice whenever you play it back.
Right.
Get used to just stuttering a lot and doing retakes and having to do it over again, and you're just like my first, I don't know, 50 videos or so, or I don't know how many. They were not as good as they're getting now, and I still feel like I can improve a lot. It's only going to get better. You just have to start and keep going and keep going and keep going. I always think of like great actors. When you
Mhm.
see them in their first movie roles, like the other day, I think Samuel L. Jackson's a really good actor. He's been in a lot of movies. A lot of people probably know who he is. But if you see some of his very first films, I was at a relative's house and I saw a film, and Samuel L. Jackson looked like he was 19. He was
Oh wow.
really young, and he wasn't even the main character in that movie. He was, he was actually playing uh, some bad guy. They were it looked like a restaurant or something, and he was trying to rob the place. And he did a decent job, but that it wasn't his best role ever compared to all the stuff he's done now. But I'm sure he's grown and developed as an actor over time, and it's kind of the same thing with all this marketing stuff, all this video marketing stuff. You just have to keep going, keep going, keep going, and then you get better at it. Second tip is definitely get better at the technical side of it. If that's not your thing, then get some help. Hire somebody like Cessa to help you out with it. um, I'm blessed in that I've always been a techie person. I've liked fiddling around with computer programs and videos and video editing software and websites and all that stuff. And I'm not the best in the world, and I actually hired a person to help me out with it, and Cecil helped me out back in 2018 when I was just starting out with YouTube stuff. So you need help for sure. It's professional work. And then the third tip I'd have to say, once you start, you cannot stop. You have to keep going. One video is not enough. We have different campaigns, and we're constantly redoing videos on them. And we're not redoing them in the sense that we're scrapping the last one. We're just adding on to it, fortifying it, optimizing things, making it better. It's a never-ending process, but the fruit is amazing, because we get clients that come in that, brand new clients that we've never met before, and they say, I've been following you on YouTube for a year now.
Wow.
And I'm like, whoa. And I'll dig into it a bit, and they're like, yeah, every time I'm a subscriber, and every time you release a new video, I get notified and watch it, and you're so helpful. We just had a lady that we interviewed. It's up on our YouTube channel now. I did a Zoom interview, and she's in New Jersey, and she saw one of our most popular knee pain videos, and she was just so grateful that we put that information out there. And I put that video out years ago now. It takes that long for people to find it and think about it and do it, and then eventually they'll work with you, and you have to have a process to get them to work with you eventually from there, because once they see a video, if they're not in town with you, then how are you going to help them out and possibly even make some money from it? That's a whole other topic.
Right. And I think it's really important to point out that, like you said, that lady was following you for a year. Is once a patient sees you on camera, they're going to get to know you. They're going to know your personality. So when they meet you in person or talk to you on the phone, it's like they already know you. They already know your personality. So that's really good to hear, and for you to share that with us. I really do appreciate that. But Dr. David, for more information on your practice, your services, how can people contact you? Aside from YouTube, how can people schedule to see you, or if they would like to have more information on getting treated for any shoulder pain, neck pain, or physical therapy service?
Yeah, the easiest thing to do is to go to our website, epmanualphysicaltherapy.com. And there's tons of information there. There's helpful resources, a lot of free stuff. If you go to the blog tab at the top, you'll find tons of blogs about all kinds of different body aches and pains that we help out, and free resources on there. And if you're in the area in El Paso, then the phone number's on there, 915-503-1314. It's all over the website too. And you can just give us a call and start the conversation from there, and see if we can help you out. We always are honest with people too. We just want to make sure that we're the best fit for everybody. So if we can't help you out, then we're happy to say it's not something that we work with. You should go see these people instead, or this type of person, and they'll be better suited to help you out.
All right. Well, Dr. David, I know you're a busy guy. You have your own practice. You have a family. You have 3 kids, right?
3 kids and 1 on the way.
Oh, wow. 4. Well, congratulations. I got 4 myself, and oh man, all I can say is good luck. But I appreciate you taking the time to speak to us, and we'll talk soon again.
Okay, sounds good, Cessa. Thanks for having me on.
All right, thank you. Have a good one. Bye.
All right, you too.